Pfizer now asking the FDA to authorize its version of the vaccine for use in kids 12 to 15 years old. Last week, Pfizer reported the vaccine proved to be 100% effective during trials for that age group. Chohanke explains when vaccinations could begin if authorized.
Currently, Pfizer's COVID-19 vaccine is available to anyone 16 and older, but that could expand in time for school this fall.
This is a very, very positive move for the country to get us to herd immunity fairly quickly.
Dr. Cecil Bennett, medical director of Noonan Family Medicine Associates, says vaccinating children is necessary to reach herd immunity. And the primary concern he hears from parents is about having their children in school safely.
And they know that having them vaccinated would allow that to happen, but it also allows parents to go back to work. And if parents can go back to work, that means that the economy can go back to normal.
Today, Pfizer tweeted, "Our hope is to make this vaccine available to the 12 to 15-year-old age group before the start of the 2021 school year." A Georgia Department of Public Health statement reads in part, "It is as important for this age group to be vaccinated as it is for older individuals. Children can develop COVID-19, and for children with underlying health conditions, it may cause serious illness."
The risk process is the same, risk evaluation process.
Dr. Grace Gouda of UGA's College of Pharmacy says next, a process similar to November and December will play out, when vaccine trial findings were reviewed in public meetings before the FDA eventually authorized Pfizer's vaccine for anyone 16 and up. If the FDA allows its use to expand, Gouda says 12 to 15-year-olds have an immune system close to that of an adult, so she expects similar side effects.
It would be very close to what we saw in adults, such as injection site reactions, maybe a mild body ache or some fever.
And we reached out to Governor Brian Kemp's office tonight and asked what plans, if any, are in place to eventually vaccinate children here in Georgia, but so far we have not received a response.
Many parents will soon have to make a decision. Will you get your child vaccinated? It is a big debate happening online tonight. We are where Atlanta speaks. Some, like Mary, tell us, no way. While others, like Missy, say, I will not force my kids, but I will talk to them to make sure they understand the risks. So where do you stand? Speak up on the 11 Alive Facebook page. A Georgia vaccination site is hitting the pause button on the Johnson & Johnson one-dose vaccine. We're one of 4 states where a small number of people reported reactions. So here is what you need to know. The Department of Public Health says 8 of the 425 people who got the shot had reactions. It happened at the Cumming Fairgrounds site Wednesday. DPH says it is looking into it, but the side effects were consistent with common reactions for any vaccine and say there is no reason to believe there's anything wrong with the shot.
I think this sort of thing is happening in more or less in most clinics across the country, no matter which vaccine is being given.
Second, the CDC says it's aware of the reactions people had to the Johnson & Johnson shots. That includes dizziness, feeling faint, rapid breathing, or sweating. They are still encouraging sites to give out the shots. And third, we want to stress this is only happening to a very small number of people. We have to give you that perspective. 45 had reactions out of the nearly 5 million doses given out nationwide. Johnson & Johnson tells 11 Alive tonight they're taking action. It's collecting necessary information and carefully assessing the events.